thanks again for this very important snapshot of the status of Florida children. A few things caught my eye in going through the profile. The fact that 20% of all children in the state of Florida live in poverty is completely unacceptable. And it will have dire consequences for the ability of those children to succeed in life. And it has an impact on the overall well-being of the state of Florida. So what that tells me is that we've got to prioritize our investments for these kids to make sure that they have access to health care, that they can see a pediatrician on a regular basis, that they have access to nutritious meals and the basics and food, that they have access to high quality education, especially in the early years. Another item that really jumped out at me, the fact that in Florida, our asthma and pediatric cancer rates are higher than the national average. That tells me that we have a lot of work to do in the state of Florida, cleaning up our air, cleaning up our water, reducing toxins, and enforcing environmental laws. You know, it really hit home, this recent American University study that directly linked the Environmental Protection Agency rollbacks of environmental laws to higher COVID infection rates and mortality rates. The other one is, and I want to thank you all for focusing on the worsening climate impacts as well. Climate impacts in Florida, like extreme heat, and what that means to kids' health, and it aggravates those asthma rates again. They're getting worse, and climate impacts are particularly impacting vulnerable communities, like communities of color and kids. And if you're a child in poverty, you're facing extreme inequities. So that what that tells policymakers is that we need to switch over to, we need to clean up the air. Particularly, that means transitioning to and building the clean energy economy in the state of Florida. Here we are, the Sunshine State, and we generate very little of our electricity from clean and green solar power. So we can do better. And we've also got to make our communities more resilient. And resilience now really should start in the most impacted neighborhoods. And that includes our public health infrastructure. It includes the data that we need to make decisions. It includes medical supplies, the ongoing challenges with supply chains. COVID has really shined light on how there are great inequities and weaknesses all across the country. So, in fact, in the 2018 National Climate Assessment, it said that health-related climate impacts will not be distributed equally, but will exacerbate inequalities. So what this profile demonstrates, along with my committee's recent report, Solving the Climate Crisis, is it lays out a blueprint for action. And that's what we need now. Based upon this type of profile, we need meaningful action on clean energy, on adaptation, on children's health, our entire public health infrastructure. Because in the end, we have a moral obligation to our kids to make sure that they have a livable planet, a livable state. So I want to thank the Children's Environmental Health Network for making sure that children are at the center of solutions and giving us this action plan to move forward. So thanks again.
Thank you so much, Representative Castor. Next, we're going to hear from Dr. Jones.
Hello, everyone. As a pediatrician, mother, and Florida resident, I'm grateful to be able to participate in this call today to advocate for children in regards to environmental hazards such as mold, water, air pollution, climate change, lead exposure, and poisonings, and disasters that can negatively impact their long-term health and well-being. As a spokesperson for the American Academy of Pediatrics, I support the AAP's effort since 1957 to address pediatric environmental health issues. Currently, we maintain a Council on Environmental Health and Climate Change. We offer guidelines through a policy statement on environmental health and climate change, and collaborate with experts nationally through a policy pediatric environmental health specialty units. And you can visit that information in experts, pehsu.net. The Flora report has valuable information, as we've all stated. So I want to highlight two key takeaways from a pediatric perspective to demonstrate the impact that environmental hazards have on children. There are some areas where Florida is falling behind, some areas where Florida is doing well, and there are some areas where Florida is falling behind in national rates. One being asthma, as mentioned previously. 9.5% of children under 18 in Florida have asthma, while that rate is 7.6% nationwide, as you can see in the Florida report. We can improve on this. For example, my patients are underserved and disproportionately affected by common childhood conditions like asthma. Their environments are often riddled with asthma triggers, such as crowding, poor quality housing, poor air quality, mold, roaches, etc. In addition, climate change leads to worsening natural disasters, as we know, heat stress and air quality, as well as shorter winters, leading to longer allergy seasons, which can trigger asthma symptoms. So our practice is no stranger to frequent visits from our patients for asthma, or follow-ups from ER visits, or hospital admissions due to severe asthma attacks. Parents have to take days off from work. Kids are out of school, whether it's virtual or in school in present, and healthcare costs keep rising to something due to something that can be preventable or improved upon. The other area of concern that I notice is childhood cancer. There are just under 190 cases per 1 million people of pediatric cancers in Florida, compared to 181 cases per 1 million people nationally. Cancer is a leading cause of disease-related death in children in the U.S. Some childhood cancers are caused by environmental factors, such as various chemicals, power lines, certain virus exposures, and prenatal exposures. Although we are getting better at curing cancer in children, the process from diagnosis, treatment, and cure is long and hard on families. And even if a child survives, the battle isn't over, because many face poor health outcomes like infertility, damage to multiple organ systems, and risk of second cancers. So we need to find where the cancer-related environmental health hazards are in our community and work to eliminate them. So overall, this type of data helps to inform where we need to focus our environmental health efforts to ensure a safe future for our children. Thank you so much for having me today and the work you're doing.
Thank you, Dr. Jones. Our next speaker is Dick Batchelor.
Good morning, everyone. First of all, let me say congratulations to NSA and her entire staff for this great work product. And secondly, Dr. Jones, thank you for your participation. And Congresswoman Castor, I shouldn't be too personal, but I actually served in the legislature with the Congresswoman's stepfather and mother. So I know a lot about that family. And I did well in the legislature because I voted like they told me to. So it worked out very well. I'm asked to give you some kind of a historical and anecdotal kind of a briefing. I grew up in North Carolina. My parents were sharecroppers. We were tobacco farmers. I used to put on DDT by hand and other chemicals. I later joined the Marines and got exposed to Agent Orange while I was serving in Vietnam. And then secondly, I got a notice from the Marine Corps that where I was stationed, there were toxins in the water supply and that I might be subject to one of the listed diseases, all terminal. And if I was diagnosed, I could get treatment, but it'd be a bit after the fact. My legislative days gave me some kind of perspective on that. And one of the things I worked on was legislation that I actually proposed that you would think would not be radical. Farmers were putting pesticides in the field, aerial spraying with the workers still in the field and the children in tow. So I introduced a bill that said it should be illegal to have aerial spraying of pesticides while the workers are in the field. God forbid, the legislation actually failed. My compromise was to say, can we have at least facilities where then they clean their hands for themselves and their children before they take a break and have maybe a sandwich or a snack? That also failed. And that was in 1976, when you think they would be more open-minded about those kind of things. I remember introducing the first hazardous waste law in Florida, which we did pass, but I remember the lobbyists for Monsanto telling me it was socialism. And that kind of a word that we somebody has reinvented, I think, but it just shows you how difficult it was. But keep in mind, in 1970, the Clean Water Act and Clean Air Act were passed during the Nixon administration, a Republican administration. Keep in mind, too, that Chairman Ruckelshaus, who is a legend and was a legend, on behalf of the Republican administration on environmental issues. So it's not a bipartisan thing. People take this very seriously. I would also say that it's important to stay focused on these children, as the Congresswoman and Dr. Jones pointed out. These are little people. They have inordinate impacts on them from environmental factors, lead, mercury, endocrine disruptors. It could be a whole host of things. So I think Florida, in a lot of the report, maybe even needs to look at creating their own committee in the legislature, not to focus on all overall environmental issues like natural resources, but focus in and hone in on these environmental factors in orderly impact children, and focus on how do we protect these children. So we have a long way to go. Now, during the Clinton administration, there was an executive order which was asked for and signed by President Clinton, creating by executive order again, the Children's Environmental Health Protection Group within EPA. And I was asked to serve in that group and did for a while, but then I left during the current administration because there's so many forceful pushbacks of environmental protection, particularly as it affects children. So while we have come a long way, we're beginning to go the other way. And all we're saying with this report is focus on these children, make it child-centric. These are little people who have inordinate impacts that are very severe, as pointed out by Dr. Jones. So we hope the state of Florida and its leadership, from the executive branch to the legislative branch, will take this report as we disseminate it and focus on maybe, again, creating a committee that will absolutely focus on these issues as it regards children. So that's my hope, that this report would generate that kind of conversation, but more importantly, that kind of action to better protect our children.
Excellent. Thank you, Mr. Batchelor. And thank you so much to all of our speakers today. We are going to go ahead and open up the floor to questions now. So if anyone has a question, please go ahead and enter it into the chat box, or you can also raise your hand.
Raise your virtual hand.
Your virtual hand, that's correct.
And while we're waiting, I just want to note to Dick's point, who's also a board member for the Children's Environmental Health Network, our vice chair, and we have Layla McCurdy, another board member on. Thank you for your support, Layla. In Maryland, I believe we are the only state that has a Children's Environmental Health Protection Advisory Council. It is appointed and created by the governor, and we have actually been able to sustain our existence through multiple governors. So I know California's been talking to a few of us about possibly creating one. So we don't create legislative action. We more give our public health guidance, recommendations, encouragement. We do create statements, that type of thing, but at least that might be a first step to consider. There is a model. It's in Maryland, and Florida could potentially think about how to make it your own, and maybe there's an expansion. I think, Dick, what you're talking about is an actual committee, and obviously that's a different type of responsibility and authoritative control and all of that. But I mean, I think any of us in the child health advocacy space would be happy with any form of institutionalized practice of putting children first and having people responsible for that type of action, and to be working, in tandem with some of those different branches of government. Congresswoman, is there anything that any of us could be doing on, to help further support the wonderful climate leadership that you're providing in the state of Florida?
Yeah, at the end of June, we rolled out our Solving the Climate Crisis Action Plan. It is a blueprint for the Congress. It highlights a number of bipartisan bills, but we say we've got to get to net zero clean energy as soon as possible, no later than 2050. And boy, the state of Florida here has could really take a bite out of that number by transitioning to clean energy, and that would have enormous impacts it would improve our kids' health across the board. It would improve the public health. It would create a lot of jobs. It would probably help us tackle that 20% kids in poverty number over time. So I encourage you to read it at climatecrisis.house.gov. Okay, it's over 500 pages, but we have a really good executive summary. And while people are staying home and staying safe, I recommend it to you.
Thank you so much. Definitely encourage all media on the phone to please do that. And obviously any way that we can all be helpful in helping to get the key points of this report out through your contacts and your mechanisms, happy to do that even after this call. Dr. Jones, really appreciate all your comments as well, and really lifting up the notion of childhood cancer. The Children's Environmental Health Network is part of the Cancer-Free Economy Network, which is, I think, a very novel approach, collaborative approach that's bringing in multiple disciplines and really trying to change the paradigm of how we look at cancer in the US to not just be treatment almost only oriented and funded, but also wouldn't it be nice to not have to find a cure in many cases, because the cure would be a non-issue. And so obviously not all childhood cancers are related to known environmental triggers, but we are actually part of a larger report. The American Sustainable Business Council, Max Cure Foundation, and many others, Naturepedic, some great forward-thinking sustainable businesses are a part of this release that will happen in September. And I will encourage everyone, and we'll make sure everyone gets a copy, but really appreciate that uplift. In Florida, what are you seeing in the cancer side? Oh, can you hear me? No? She's saying
I hear you.
hear
It's better now.
Okay, good.
Okay.
So, Dr. Jones, we're just wondering, is there anything more you want to say on childhood cancers and what you're seeing in practice, and maybe any relationship because of your knowledge of environmental triggers to what you think also might be going on in the state?
Absolutely. As far as childhood cancers go, they continue to be on the rare side. Now, when we say rare, that, makes you think, okay, don't worry about it. No, that's not what we mean. But luckily for children, and so rare to the point where we don't have any kids in our practice right now with childhood cancer that we know of. So it is even rare for me to see. Obviously, when I trained, I saw many more patients. But still, we know that there are environmental cues to childhood cancers, and one child with cancer, we would want to prevent that, as you mentioned. And so we would want to remove those environmental factors that could play into that. Absolutely. I think when it comes to my patient population, and when we talk about poverty, definitely working in those areas to achieve equity in the lives of families so that they have safer environments, so that they have better air quality, they have quality housing, that they're not having to be crowded into situations. All of those, repairing all of those social determinants of health that create these health disparities and health inequities. We really need to continue to take huge bites out of that, so that our families and our children have a better chance at life and in being able to avoid these hazards.
Thank you. And you all will see in the report certain pesticide classes, certain solvents, and certain air pollutants are sadly directly connected to certain forms of childhood cancer, which cannot be attributed to behavior such as alcohol and other things at a 4-year-old, 5-year-old level. So thank you. And if there aren't any more questions, we're checking on the media. Just one final question for Dick. Also, you've been a wonderful public health advocate, a public policy leader for decades. What advice might you have for those in Florida trying to cut their teeth on some of these issues? There's so many issues to prioritize. What do you think we most need right now among our emerging leaders, not to mention our existing leaders? Any advice on that front?
Yeah, I would think, I was giving some thought to it after the Congresswoman's comments. Florida has, of course, a Department of Environmental Protection, and would be a good place for some of us to start, not lobbying, because we're not allowed to lobby, but we can certainly educate and inform. But also, Florida has a governor's children's cabinet on children and youth, and it's the chair is the First Lady of Florida. And I must say, the governor has taken some environmental steps in the state of Florida that are very, very encouraging when it comes to natural resources, preservation, land, and things like that. And the First Lady has been heavily involved in chairing the governor's cabinet on children and youth, looking at different indicators. But I would be glad to work with some of my colleagues on the phone and approach, starting with the First Lady, because they already have a platform. They would all they would have to do is add maybe a component of children's environmental health to an existing platform. So I'd be glad to work with some of my colleagues to get something like that done, very specific within the time frame. It's certain. Thank you for the assignment.
You can always count on me, Dick. No problem.
And I would also add that my role as a pediatrician and the healthcare industry could definitely and continues to be in the area of children, talking to families and educating them as well.
Right.
A lot of families may not realize some of the products they're using or some of the environments that they're exposing their children to are harmful. Some do. Some come to me and tell me about the mold in their building or the subpar nature of their housing, and ask, could this affect my child's health? And we try to give them the resources to improve their situation. And so I think having that information for families and the resources to advocate for themselves and also learn about what they can try to avoid is also important. And we do our part as well with screening lead and all sort of environmental screenings throughout children's lives to make sure they aren't in those toxic ranges.
Right. Yeah, I think, as I might respond to that, and say that I think having positions such as yourself and our national association be actively involved lends a tremendous amount of credibility, because your research is empirical, it's specific, it's not an opinion, it's not it can be public policy, but it doesn't have to be politics. It's empirical data over and over again. So having the health community such as yourself involved lends tremendous credibility to what we're trying to bring to the attention of policymakers.
I agree.
Boy, there's never been a more important time to listen to scientists.
Yeah, absolutely. Absolutely.
Exactly. Well, thank you, everyone.
Thank you, everyone.
Last call? All right.
Thank
you so much to all of the
Thank
excellent speakers, and for everyone who joined the call today on this really important conversation around environmental hazards, children's health, and health equity. Have a good afternoon, everyone.
Thank you very much.
Bye-bye.